வணக்கம் எல்லாருக்குமே. ஓகே, ஸோ இன்னைக்கு வந்து டாக்டர்ஸ் டே, July 1st. எவ்ரி இயர் இட் இஸ் செலிப்ரேட்டட். அண்ட் அன்னைக்கு வந்து ஏதாவது ஒன்று நம்ம பீப்புளுக்கு நல்லது பண்ணணும். ஸோ ஐ தாட் ஆஸ் அ டாக்டர் கைனகாலஜிஸ்ட், நான் வந்து டாக்டர் சந்தியா வாசன், obstetrician and gynaecologist, practicing for more than 12 years now. So I thought as an awareness program, I should give an awareness about breast cancer. Why breast cancer? Because at present it is the second most common breast cancer in India. And in the rural areas, you can say it is the first most common also. And Chennai also, it is seen in 25 to 30% of the women are suffering from breast cancer. Okay, so but what has happened nowadays is, in the Western countries, the breast cancer, which was very common, is reduced now. But in India, it is not reduced. Why? Because of not awareness about breast cancer. And women, usually they do not care for themselves. They usually think of the family first, their husband, their children. They don't give care to themselves. So then, that's why a woman has to give utmost importance to her health. Women's health is family's health. So what is breast cancer? It is most common. Usually when you see around 25 years back, it was a disease of above 50 years. But if you see now, the less than 40, around 30 to 40. So why this age shift? Because of the lifestyle modification. In the olden ages, all women, they'll become pregnant by the age of 20, 22, and the childbearing will be around 30, 35, and sometimes infertility is increased because of a lot of lifestyle changes. So then they don't have babies. So they say the breastfeeding decreases the incidence of breast cancer. And there are other reasons like lifestyle changes and so many reasons why the people develop breast cancer. So then what you should do? We can prevent it. How can we prevent it? There are three things which you can do. One is which you can do at home on your own. That is self-breast examination. All ladies, this is my request, that whatever age you are, you have to do a self-breast examination every month. So when you should do? You cannot do it any day whenever you want. So after you get your period, 1 week after that, you do a self-breast examination. That is, you just sit in front of the mirror, palpate the breast from all sides in a circular pattern, look for the nipples, whether there is any retraction, and if there is any discharge. If you find any nodules or any retraction or discharge, then it is abnormal. Go and see your gynecologist, or there are special breast units like there are special breast units where the oncology surgeons will be there. You can go and examine yourself there. That is one thing which you have to do every month. Second thing, what you have to do is, above the age of 40 years, all women have to undergo a screening test called mammogram. In Western countries, it is compulsory. Every year they have to do it. But in India, what has happened is, people, though they have the knowledge that they have to do a mammogram, they will not do, because they think it is very painful, or most of them are unaware of what is a mammogram. So a mammogram is an X-ray which they take. So in that, even if there is a small lump or early stages of cancer can be detected. So why should we do the screening? See, when you come with most of the time, if you see in Chennai, the people who come with breast cancer are coming in later stages, stage 3, stage 4, where you cannot do much to them because the 5-year survival is very less. So if we do the screening test, you can detect the cancer at a very, very early stage, when you can have a 100% cure. So that is why we are talking so much about screening. Because once when you screen a disease, you can screen them at the earliest, detect the disease at the earliest, and you can give full cure for them. So then they will have a normal lifestyle like any other women. So once you come in stage 3 and 4, then you do the surgery, they will be having the normal lifestyle will not be there. Because then you will have to give them chemotherapy, the drug and all those things. So then it is difficult. So what every woman should do is go in to a nearest gynecologist or to an hospital where there is a proper mammogram. And mammogram also should be done in a proper center, because sometimes you should not get a false assurance. Okay? So you do a mammogram. Ideally it has to be done every year, But for our Indian setup, we can do it once in 2 years also. So in that, if it says everything is normal, then once in 2 years, go for a mammogram, and as usual have a routine self-breast examination. And every once in 6 months to 1 year, go and get yourself examined by a gynecologist, so that even if you have missed something, they will identify it and they will suggest you the further management. So nowadays, if you see previously when you see the age for breast cancer used to be above 50, but now we are seeing less than 40. And less than 40, this 30 to 40, the breast cancer is more aggressive. They will usually not respond to a lot of treatment also. They will be that hormone negative, so it is little difficult to treat. So it's not that only after 40 years I will start doing my investigation. No, it has to be started at the earlier ages. From 20 years itself, you start examining yourself. And my sincere request will be that please take care of your health, because your health is family health. So please all women, please take utmost care of your health. You are safe now, your family is also safe. So then, this is from my point of view. Now there are certain NGOs who are trying to help this awareness program. One of them is the Chennai Turns Pink. So this is a NGO which is started from 2003, and they have been doing a lot of work for breast cancer awareness. They have selected a lot of college girls, young girls, and trained them into how to do self-breast examination, and to train the other people surrounding them about self-breast examination. So then the awareness is created among a lot of people. They go to a lot of rural areas and do some work on self-breast examination, then screening. They motivate people to go for screening, and they motivate people to go and get the treatment, come out of their shell, and teach people like what to do and when to do and how to do and where to go for the treatment. And I think they are doing a very good job. They have done a lot of work. They have done some run, and they go to the hospitals and give some talks. They have a lot of ambassadors also who are doing a very good job about self-breast examination and cancer awareness. So I request all the people to support them, support Chennai Turns Pink in all their endeavors. And my personal wishes to Chennai Turns Pink, all the best, and you can take my help anytime. Definitely I will be there to support Chennai Turns Pink.